Just a couple little clinical pearls. Typically you'll see in 20-year-olds, if you look at pain as in adults or people, usually 20-year-olds will have more muscular pain. As you go through life and you kind of get around 40, people usually have more disc pain. And as they get down more to about 60 or 70, typically it's more stenosis or arthritis. And so all those people will tell you they feel the same. But one just little clue to remember, about 20 years old, you're more muscular. As you start to age up to about 40, you're still muscular, you're getting more to a disc. And around 40, you're still mostly disc. And then you start to dry up and get compressed and get old and shrink, and you get kind of more down to bone. Unfortunately, it's the progress we all have. We're all heading in the same direction. None of us get out of here alive. So that's something important when people come in with pain. You can just kind of look at their age. And again, be careful with generalizations because you'll get caught and you'll screw up. But it is a nice key just to kind of help you understand potentially where the source of their pain might be coming from. A very nice way to understand where their pain is coming from is, do you hurt more when, and these are not in notes, just listen, because I want you guys to clinically, it doesn't matter if you can treat back pain, if you can't diagnose it correctly, you're going to screw it up. So a really nice way to ask people, does your back hurt more when you poop or pee or laugh or cry, sneeze or cough? If it does, it's a disc. Because as I out, the same pressure physically is inside. Equal and opposite reaction. As I poop and put pressure down, or as I pee and put pressure out, that pressure comes in, and that pressure will push my disc. So people hurt more with any of these types of things that create pressure, it's a disc issue. If their pain is radiating, then you know the disc is impinging a nerve, because it's radiating down their leg. If they have more pain after they walk a while, then you know, so well, my back's fine, then when I walk a while it starts to hurt, you know you've got more compression, because their bones are starting to compress with gravity over time. If it doesn't radiate, then you know you don't really have a disc problem and a nerve problem, it's just more bones and muscles kind of right where it is. A lot of people, especially elderly people, will feel better like basketball stars. They're like, I feel good, I hurt, but then when I kind of go like this, I feel better. Because I'm stretching my spine, I'm taking pressure off my L5-S1. That's why a lot of people feel fabulous when they sit down at night and they put their legs up. You can tell your patients, put your legs up, does your back feel better? Yes, because right now I'm stretching out my spine, my L5 is creating space between my S1. If they feel better that way in your clinic, you know they got compression at L5-S1. So these are just little tidbits to know what we're talking about, or what kind of pain they have. Very helpful. You can certainly palpate, you can feel the muscles. Usually the quadratus lumborum is a very involved muscle. It's very deep. If you look at like a sail, you've got rods, you've got lines from the middle of the sail to the front of the boat. That's like your psoas muscle. It holds your spine front. And then the QLs, or the quadratus lumborum, if you've got your sail, you've got lines that go from the sail to the back, and that's what holds you from the back. So these are two strong muscles that are holding your staff, or holding you up. And when those get jacked up, then you hurt a lot. That's why when people hurt when they bend, those are usually the QLs, right? Or the erectors. The big thing with back is where you'll screw up is you've got to think in layers of muscles. So like I said, we've got the latissimus dorsi is very superficial. We go a bit deeper. Erectors paraspinal is a bit deeper. Multifidus a bit deeper. QLs. Think in levels of depthness of muscles. That's why sometimes you can treat back pain and you won't get it because you've got maybe 1 or 2 levels, but you didn't get all the levels of all the different muscles. A lot of muscles back there. It's just not back muscles. So let's go over some points.